Preface. This book draws upon three sources of inspiration. First, several of its themes or elements first emerged in our previous research on the politics of tax reform, the federal budget, federal grants in aid, and federal mandates. We wish to build on our earlier insights about the complex dynamics and changing character of federal policymaking in a more systematic and thorough way in this book. The result spans 32 years of policy history. Second, both our earlier research and the present book have been informed by our experiences in government, where each of us served for periods ranging from 5 to over 25 years. Among us, we have worked in both the executive and legislative branches of the federal government, as well as at the state and local levels. From this perspective, we feel that too many existing treatments of public policy fail to fully convey the dynamism and changeability of the policy process. We faced a similar frustration in our search for literature to assign to our students in graduate and upper division courses on public policymaking and the policy process. We like and use much of the existing literature in these courses, but, as we explain in Chapter 1, all seem lacking in portraying the dynamic interactions and energy that characterizes policymaking today. Having tested the framework developed in this book on both full-time students and part-time working professionals in our MPA program, as well as graduate and undergraduate students in political science, we are convinced that students at all levels like it and learn from it. The audiences for this book mirror its sources of inspiration: our students, our colleagues in the academic research community, and our professional colleagues in government. Such diverse audiences inevitably necessitate striking a balance between divergent needs and perspectives. The level of sophistication appropriate for our colleagues in academia and government risks confusing students with less grounding and knowledge about the policy process and specific cases of policymaking. At the same time, providing students with the foundation they need to understand the arguments can become tedious to knowledgeable scholars and bureaucrats. But many academic works encounter this tension, and we hope and believe that we have struck the right balance. Chapter 1. Introduction. In 1997, Congress enacted cost-cutting reforms to Medicare that reflected expert consensus about the best ways to moderate growth trends in health care costs, such as limiting overly generous reimbursements to health maintenance organizations and home health providers. The legislation also established a sustainable growth rate formula for reimbursing doctors under Medicare, as well as a new program to support health services to the children of low-wage workers. This latter program, the State Children's Health Insurance Program, SCHIP, also reflected expert consensus on the long-term benefits of improving health outcomes for children. The legislation passed with broad bipartisan support in both houses of Congress. Beginning in 1999 and in virtually every subsequent year for the next decade, provisions of the 1997 Medicare reforms were trimmed back in the face of vigorous lobbying by health care provider groups. Bipartisan majorities in Congress passed revisions in 1999 that were estimated to increase Medicare spending by $27 billion over 10 years, followed by legislation in 2000 that was estimated to increase spending by $82 billion in the next decade. Although doctors failed to eliminate the sustainable growth rate formula, aggressive lobbying by the American Medical Association and other physicians groups led Congress to pass doc-fix legislation every year between 2003 and 2009, which temporarily suspended the limits and raised doctors' fees under Medicare. In 2010, President Barack Obama signed legislation that extended health insurance coverage to millions of uninsured Americans. This law marked the culmination of decades of Democratic efforts to establish a program of universal health insurance.